Hey guys, this is Dr. Echols again. Corrina is going to help us demonstrate today a little bit about what I would call lower back, pelvic, leg type disorders. And the way in the system that we use, we actually break these problems down into what we call categories. Category 1, 2, 3. And this really helps us to make sense of lower back problems and how to correct them. Now, before I learned this, if somebody came in and they go, oh, my hip's out of place and I need you to adjust my hip. I would adjust that hip and they would probably feel better, but within a couple of days or a week or a month or a year, they would come back again and they would be, okay, Dr. Echols, you adjusted and it felt great for this amount of time, but now it's back again. And we would just keep doing that over and over because I didn't really have an understanding about, exactly the mechanics of how it worked. So if you think about a pelvis, and I wish I don't have a little spine here, but if you think about a pelvis, the pelvis is this. It's your bones here in your hip, and it's what your spine comes up out of. So if you think about a pelvis, it should be straight and square, but what happens is a lot of times pelvises will twist or they'll rotate. They'll get out of position. And that doesn't necessarily mean that they hurt. But if left long enough, and if you keep walking around on it long enough, it will start to cause problems. Kind of like if you had your car tires out of alignment, and it may not really be a big deal, but if you drove it long enough, you might need a whole new front end after a while because there's so much strain and wear and tear on it. So what we found was that when a pelvis is out of place, it's generally an adaptation to other problems that are happening in your body. What does that mean? Well, in other words, you've got a shoulder problem, you've got a neck problem, your elbow might be out of place, your foot's got a bone out of place in it, and all of these things are causing your pelvis to be twisted. So your pelvis is actually compensating for all of these other problems. So that when you go ahead and you just adjust the pelvis, the body basically is saying, hey, I had that where I wanted it because you got your neck out and your shoulders out and this is out, and I had to have my pelvis there in order to walk straight. You see? And so what does it do? It just puts it right back. And that's why within a few days or months or whatever, you start having problems again. So there was a technique developed where we can actually block the pelvis, and I'll show you how we do this in a minute. We actually block the pelvis into the correct position. We check to make sure that it is in the correct position. And then, like a detective, we go looking for all of the reasons the body has put the pelvis in that way. Is it in your neck, shoulder, wherever those problems are, and we clear them all away. So that now, when we go to adjust your pelvis, it stays because there's no more reason for it to be that way. Then once we get the pelvis lined up, then we need to adjust the sacrum and get it lined up properly. And then when we do that, we line up each individual vertebra of the spine in the back. And after that, that person is fixed. And they are good to go. And as long as they don't mess it up again, they should be good and have no problems really to speak of after that. Rather than it just coming back over and over and over again. And you may have had that happen to you. I certainly had that happen for years in my practice until I learned this. So let's go through the different categories and kind of show you how they work. Okay, so this is what we call a category 3 pelvis. And basically my understanding is that sometimes the pelvis and the spine can get kind of out of joint with each other or out of sync with each other. I don't know if anybody's ever felt that way, kind of like their lower part just isn't quite in, jibing with the rest of their spine. But if that happens, we call this a category 3 pelvis. And the way we test for it, first of all, we want to make sure that we have a good strong hamstring muscle. Push right here for me. And we do. And then we're going to get right on the L5 vertebra, and we're going to just push the L5 vertebra this way while pushing on the sacrotuberous ligament this way. Just like that. And then we retest, push here, and that is nice and strong. Now we're going to do it the opposite way. we're going to push the L5 vertebra this way and the sacrotuberous ligament this way. I'm pushing basically on the sacrum at this point, right here at the coccyx area. Push here, and that's real strong. So if one of those would have been weak there, we would have taken these blocks and we would have put them right under the hips like this. So in other words, if we would have pushed the vertebra this way and the sacrum this way, and our muscle went weak at this point, we would know to put this block on the high side right here, and this block is on the low side. And now what we do is we would go find all of the reasons why this is not working properly. And it could be up in her neck, it can be up in her upper back, it could be in the lower back, it could be just about anywhere. And we would kind of be like a detective and go around and find these until we got to the point where when we take these blocks out and we challenge it now it stays strong. And that's how we would fix what we call a category 3 pelvis. Now I'll show you how we would test and treat a category 2. And we do these in order. This is the first thing we would check. Category 3, it's backwards. It goes 3, 2, 1, 3, 2, sacrum, 1. So I want you to go ahead and turn over on your back now for me. And the way we're going to check for a category 2 pelvis is by checking the sartorius muscle. So the way we do that is we have them bring your leg way down like this, and I want you to, Corrina, I want you to pull your heel to your bottom for me. You better hold the table. Okay, that's pretty strong. Now I'm going to move over to this one. Pull here for me. That one, not so much, okay? Feel that? Pull here. So this one doesn't work. So she's trying really hard to hold that muscle, but she can't. And the reason she can't is because her pelvis is torqued. Did you know you had a torqued pelvis?
I saw the twerking.
That's the twerking. Okay, don't get me twerking. That would lose all my subscribers. Okay. So in this case, what that indicates is that the ilium is the bone that you've seen on a skeleton. It's the pelvic bone. It's that one bone. It's the ilium. And that means that this ilium has rocked backwards. So in order to counteract that, we're going to take this block and put it here. And that's in effect going to wait a minute. Sorry. That has rocked backwards. So we're going to put it here to push it forward. I have to think about it myself every time. And that's a good thing. And then this one is going to go on the opposite side like this. Okay? Now we'll go back and we'll check this muscle. Pull here. And now it is much stronger because now the pelvis is in the correct position, because we artificially kind of shored it up and blocked it up. So this is where the detective work comes in. And I'm just kind of going to demonstrate a little bit about how we would do that. So at this point, we again want to find out whether it's a mechanical, chemical, or an emotional kind of an issue. Push here for me. There we go. And there's some mechanical things going on. And it's muscle. And so I'm just going to kind of start investigating the different muscles here. And it turns out that the tensor fasciae lata on the right side is involved here. And I'm just curious if we were to come down here and just check that muscle real quick. Push out that way for me. It's pretty weak. She can't really push out on that very well. So we would go ahead and we would fix this muscle. Put this off. Push here. Actually, I want you to hold right over here for me like that. Good. All right. So there's a spot that's going to be affected by this muscle here. It's going to be over here, and then we're going to touch right there. Is that going to be kind of tender? Yeah, she'll find that to be pretty tender. This is what people call the iliotibial band. It's also the tensor fasciae lata muscle, and it's involved a lot. This can also be involved if you have a disc problem, which she does not. But this is a great way that we can start eliminating the reasons why her pelvis is twisted. Remember, if we just were to go in and adjust the pelvis like I did for years and years, it would probably go back within a fairly short period of time because of all of these adaptations that the body's making. So we are just picking around and we're clearing them out one by one, and we would continue to do this until we've got them all fixed. Then once we do that, and this could take me anywhere from 3 to 10 sessions to actually correct everything, because we would be looking up in her neck and everywhere. And then when her body told us that it's all done, we would simply take the blocks out and we'd go retest this muscle. And it would be strong, but before we did that, what we would do is the body would say, okay, it's time to adjust this hip. And I'll go ahead and show you how we would do this. So this hip was rocked backwards, so we want to move this hip this way. So it might be 3 visits, it might be 10 visits, but once we've cleared everything out, now the body says, okay, you can go ahead and adjust my pelvis now, and we'll leave it there. So the way we would do that, go ahead and roll over here on your side for me. Now, since we didn't clear everything out with you, you will be back in 3 or 4 days, but if we were to clear everything out, you would be fixed permanently. I'm going to scoot you over a little bit. Give me this arm right here. Corrina is so good at this. Now, here's the ilium. A lot of you will remember, some people got little dimples right there. That's where that posterior superior iliac spine is part of the ilium is right there. Lean them over, and we're just going to put a little pressure down. Relax that for me. A little more.
Sorry, it's like the
table's moving. Yep.
Going into my leg.
Oh, don't do that. There we go. Now lay on your back. This table's really high. It's a massage table, but yeah, we're doing the best we can with what we got. So then, now that that's done, when we went over here and checked this muscle, it should be completely strong. Pull right here for me. And it's a much better when we do that. Now, once that's done, we want to make sure that the sacrum is in the proper alignment. And the way we do that is by checking the rectus femoris muscle, which is real easy to check. Push straight up for me here, and that's strong, and push up here, and that one's strong. Now, oftentimes, these will stay strong for a few days after we've adjusted the pelvis. So I'll actually send the person home, and then when they come back, normally one of those muscles will be weak, and it'll be time to adjust your sacrum. So I guess the point of this video is to show you that there's a real system, and there's a systematic approach to diagnosing and figuring out what these problems are, and then correcting them so they don't just keep coming back over and over and over again. That's such a pain for the patient and sometimes for the doctor too. So hope this has helped. If we can help you, just go to my website, jeffechols.com. We look forward to seeing you in future videos. Thanks, and have a good one. Bye-bye.